Do you have a mask-like effect after Botox? Have your eyebrows drooped and you don't know what to do? Don't panic. In this video, I'll show you what to do to fix it, and most importantly, what you absolutely shouldn't do because you could make things worse. Neither the doctor nor the patient wants the Botox to take effect too strongly. However, this unpleasant complication after Botox can happen more easily than you think. With botulinum toxin, there are two situations that can be very uncomfortable for you as a patient. First, when a different muscle than intended is affected. And second, when the strength of the product's effect is so strong that it looks unnatural. Others notice your changed appearance and you have trouble with everyday activities. That's why in this video, I will clearly explain what to do when Botox has taken too strong of a hold. You'll find out why this happens, who's to blame, how different toxins work, and most importantly, what you can do when the effect is too strong. Have you ever looked in the mirror after getting Botox and thought, "Oh no, I look like a cartoon character"? Or maybe you're experiencing something like this right now? Don't worry, I'll explain in a moment where this comes from and how to fix it. Why does Botox take too strong of a hold? I can answer in one word. Dosage. If the amount of toxin units administered is too high, the effect becomes unnatural. Despite the common belief that Botox is a simple procedure, the reality is quite the opposite. Every unit of the medication must be precisely tailored to your muscles and injected exactly where it's needed. Why do treatments differ each time for different patients? Botulinum toxin is a medication just like any other drug, for example, paracetamol. Botulinum toxin has its own indications for use as well as a recommended dose for each area and injection point on the face or body. However, just like with all other medications, this dosage can be changed at the doctor's discretion. In the case of regular medications, for example in tablet form, we adjust the dose depending on factors such as the patient's body weight or age. In the case of Botox, we adjust the dose depending on the thickness of the facial muscles, the activity of those muscles, and also the effect we want to achieve. Speaking of effects, there is a small advantage when the effects of the procedure are very strong, even too strong, and these effects last longer than usual. At the beginning of this video, I mentioned that if the dose is too high, two things can happen. Two types of undesirable effects. The first is that the muscles, for example in the forehead, can become completely frozen, immobile, so we have something that is commonly referred to as the mask effect. The face then becomes immobile and facial expressions are very limited. The mask effect is more pronounced the more areas the procedure was performed on. So we're not just talking about the forehead, but also about crow's feet, frown lines, or the muscles of the lower face and around the mouth. However, it's not a black and white situation. For context, take a look at my forehead. Right now, as I'm recording this video, I've had Botox done on my frown lines. It's completely frozen, and I can't move those muscles at all. However, since the other muscles aren't as frozen, the frown line itself doesn't look unnatural. Alright, so this mask-like effect is the first situation where we can say that the Botox has taken too strongly. And what is the second situation? It's about paralyzing a different muscle than the one we intended. For example, when performing a procedure for bruxism, we inject botulinum toxin into the masseter muscles, but the surrounding muscle responsible for smiling can also be affected by the Botox. As a result, the patient develops an asymmetrical smile, which causes discomfort and is noticed by others, such as colleagues at work. The last thing you want in such a situation is to draw attention to yourself, right? If you're now thinking, "But Monica, if the practitioner targeted the right muscle and injected the Botox into the correct muscle, how is it possible that another muscle was also affected by the Botox?" To explain this to you, I need to talk about the so-called field of action of botulinum toxin. As an example, think of a spray deodorant. You aim it at one spot, but the mist spreads to the sides. It's the same with Botox. The larger the dose in one spot, the wider the cloud of action, which can unintentionally affect neighboring muscles. And now, the most important thing. The field of action of botulinum toxin increases with the size of the dose. So, the more Botox we inject into one spot, the bigger this cloud will be. And if this cloud reaches a nearby muscle, it will paralyze that muscle as well. And for this reason, going back to the example of treating bruxism, it can lead to paralysis of the risorius muscle. Remember this phenomenon of affecting the surrounding muscle because it will be very useful to us later in the video. There are also other factors besides dosage that influence the area of effect. Even the diameter and size of the needle opening matter, as well as the force applied to the syringe plunger and consequently the expulsion of botulinum toxin from the syringe. However, these factors are much less significant. Alright, but what I've said so far doesn't explain one of the most common cases when Botox takes effect too strongly. At least once a week, I get a question from you in the comments under my videos like, Last time I had the same amount of Botox injected, but this time it took effect too strongly. Hardly anyone talks about this, but the final result is greatly influenced by the actual amount of toxin in the toxin. This isn't widely known, but even between batches of the same product, even of the highest quality, there can be variations in the amount of active substance, active in the packaging. These variations can reach up to 15% in either direction. This means that between one batch and another, there can be as much as a 30% difference. So, if one batch has 15% less than the average and another has 15% more, the legal limits are still maintained, but this significantly affects the potency of the same amount of the product. Usually, these differences aren't that large, but occasionally it may turn out that one batch is significantly weaker or much stronger compared to another. The difficulty is that, as a doctor, no one informs me in advance which batch it is, because each one legally meets the requirements for active toxin content. For example, recently I had one of those stronger batches, which I only found out about 2 weeks after use from my patients, who, when coming in for a follow-up, immediately said, "Doctor, this time it really took effect strongly." With patients I have been taking care of for several years, I know that the administration was the same as always. The total dose administered, as well as the dose at the injection site, was the same, but I can actually see that the effect was stronger than usual after 2 weeks and the follow-up visits. I know that I need to reduce the dose used for a given batch of the product that I know inside out, and sometimes it works the other way around. So during the follow-up, we see that the effect is a bit weaker than before, or the effect lasts a little shorter than it usually did. Exactly. For the past few minutes, I've been talking about how, with regular patients, you can track all the microchanges from procedure to procedure and adjust the amount of Botox down to the smallest unit. And here an important question arises. What if someone is getting Botox for the first time at a new place, or even for the first time in their life? How do you determine the right amount so that the Botox doesn't take hold too strongly? A new patient has it tough. The truth is, a new patient has it the hardest in this regard. We don't have anything to refer to here. That's why the doctor's expertise is crucial and decisive. At the first appointment, the patient completely relies on the experience and judgment of the doctor performing the procedure. When it comes to the result and naturalness, they simply have to trust. That's why it's important to understand that, in every case, mutual trust between the doctor and the patient is key. It's worth knowing that the effect of botulinum toxin is adjustable. This means that with each subsequent procedure, we gain more experience in how this particular patient's body responds to botulinum toxin. Simply put, over time we get to know each other with the patient, and we tailor the procedure so that the patient is as satisfied with the result as possible. And often, it turns out perfectly the first time. But the truth is, I want the results to be predictable and consistent for every patient who trusts my work. This is the perfect moment to announce the launch of my new ebook, Understanding Cosmetics. It's over 160 pages of concrete knowledge and more than 120 recommended cosmetics, selected based on their ingredients, effectiveness, and across various price ranges. Inside, you'll find answers to all the most important questions about daily skincare at home without any unnecessary marketing noise. The price is 49 zlotys, which is less than the average drugstore cream. Visit www.drmonica.pl and see why this book could change your skincare routine. And now we come to the most important part of the video. What should you do if the Botox took effect too strongly? Here are the specific steps. First and foremost, consult the doctor who performed the procedure. I want to make this clear. If a complication occurs after the procedure, it was not caused by the patient, but by the practitioner. A complication is never the patient's fault. So you should reach out to the person who caused this unwanted effect in you, and that might be difficult. However, there is another side to this, because if a patient in such a situation does not want to return to the place where the procedure was performed, but instead looks for help elsewhere, they are making a mistake. And I want to warn you against this mistake, because in terms of responding to this difficult situation, going back is actually the best reaction. I always listen with understanding to situations like, I went to this person for a procedure once, but complications appeared. However, I didn't go back for a follow-up because I no longer trust them and I never want to return there. I understand that unwanted side effects don't bring people closer together, but for your own well-being, in such a situation, you should go back to the place where the procedure was performed. Remember, you choose your doctor or practitioner not only for the good times, but also for the bad ones. I don't know any specialist who, in the case of adverse effects, would want to harm you further. Anyone who approaches their work professionally will do their best to help you. However, there is one condition. You have to give that person a chance. If the doctor doesn't know that something is wrong, there's no way for them to react and help. If you feel that something is wrong, that it's too strong, too weak, or asymmetrical, always report it to the doctor who performed the procedure. They know their technique best and know what, how, and where was administered, so it's possible they will be able to help with it. How? Sometimes these undesirable effects can be masked by skillfully adding botulinum toxin to specific muscles. This can help restore greater balance between the muscles and at least partially bring back a more natural facial expression. And do you know who is best suited to perform such a correction? Exactly. The very person who performed the procedure the first time and knows precisely what, how, and where everything was injected down to the milliliter. The doctor will also tell you exactly what to do in your specific situation, for example, at home, depending on what happened to you and which area of your face is affected. Alright, I've explained to you precisely what the first step should be when the Botox takes too strong of a hold, namely, contacting your doctor and having a checkup. However, the truth is that in many situations, practically nothing will help, and that brings me to the second step. Patience? The best method. Very often, the only and best way when Botox takes too strong of a hold is patience. At the beginning of this video, I told you that Botox taking too strong of a hold means one of two things. Either a completely flat effect or it affects muscles we don't want it to, causing discomfort. In both of these cases, patience is the best method, and unfortunately, often the only one. However, I won't leave you with just the information that you should simply sit and wait for it to pass. First of all, I'd like to refer to the situation when the surrounding muscles are affected due to the spread of the botulinum toxin. Do you remember that I compared the area of effect of Botox to deodorant? If so, then imagine that spray deodorant once again. If you spray deodorant in one direction, it's true that the scent will spread to the sides as well, but 3 meters from the point of concentration, the scent will be much weaker. And it's exactly the same with the area of effect of Botox. What I'm getting at is that even if the product affects muscles we don't want it to, the effect on them will be weaker than at the central point. And that means such complications, asymmetries, and paralysis of that muscle will last shorter than in the area where the treatment was targeted. How much shorter? Of course, it depends on the situation, but from my observations and experience, if botulinum toxin typically produces effects for 3 to 6 months, then these undesirable effects last about 6 weeks, which is between 25 and 50% of the total effects after the procedure. Is that a lot or a little? I think a reassuring piece of information is that the effects of such complications usually last only a fraction of the total duration of the toxin's effects. There is one more important piece of information that very few patients with complications are willing to believe. Here it is. All effects after Botox, both the good and the bad, will disappear completely over time. There is no other possibility. Alright, you've already seen your doctor for a checkup, and you've armed yourself with patience and calmed down a bit, knowing that the effects of too much Botox will eventually wear off. Is there anything else you can do to help yourself? There are 4 things you can do at home to speed up the effects of Botox after the procedure. Here they are. Intense physical activity, which will speed up your metabolism. Facial massages, sauna, and heat. Exercises for the muscles that are too strongly paralyzed. However, be careful. These 4 things are not a recipe for shortening the typical 6 weeks during which the toxin works most strongly to just a few days, for example. That's why, above all, it's important to have moderate expectations here. What does having moderate expectations mean in this situation? I don't have studies on this topic, but from my observations, diligently following all 4 of these things can speed up the effects by at most a few days. I know this not only from observation, but also from personal experience, because once Botox around my lips took effect too strongly, and using all these methods didn't really help. So, is it worth following these methods or not? In my opinion, it should depend on what you agree on with your doctor. Maybe your lifestyle is already so active that since you exercise anyway, have a good metabolism, and do facial massages, you don't need to do anything more. So, will home remedies help in that case? Yes, they can help, but if the Botox has taken too strong a hold, you should still expect an effect on your facial muscles for several weeks. It's a bit like treating a runny nose. Untreated, it lasts a week, and treated, it lasts 7 days. Dear ones, I realize that up to this point, this video has been watched by 2 groups of people. The first group consists of people who have had Botox, it took too strong a hold, and now they're searching the internet for help on what to do. To sum up, go back to the doctor who performed the procedure if you haven't done so already. That's your best chance for improvement, which might be possible relatively easily. The second group consists of people who don't have this problem but want to know more about botulinum toxin, for example, as they prepare for the procedure. Here, I talked about a few things that usually aren't discussed. I hope I did it in an engaging and understandable way. If so, leave me a comment under this video. It would really make me very happy. To both groups of people who have watched this far, I have one more request. I've recorded an equally interesting video about what happens to your face after many years of using Botox. I found some very interesting studies that compared through photographs a pair of twins, one of whom used Botox for years, while the other did not. So if you're interested in the topic of Botox, and you must be since you've made it to the end of this video, be sure to click on the video thumbnail that's now appearing on the screen and watch that second video. Thank you for today and see you in the next video.